Before we begin our substantive discussion today, I want to start with a few words. I ran for mayor in the aftermath of the murder of Laquan McDonald, and I was sickened watching our communities struggle under the weight of racial disparities, of systemic inequities, and of daily injustices. Seeing the video of George Floyd dying on the ground under the knee of a Minneapolis police officer, for me, brought back that trauma of Laquan McDonald's death into sharp focus. And I would believe that that happened for many people across Chicago. And we have to think, but for the grace of God, go Chicago. It's been a painful reminder that while we have been focused on fighting this virus, we know our work in facing hard truths about disparities and injustices is not yet done, and that we have to remain resolute and not lose sight of why fighting these fights is so critically important, even in the middle of, and maybe especially because we're in the middle of a pandemic. We can't rest knowing that Black mothers and fathers in our city still live in fear of getting a phone call about something terrible happening to one of their children. I know I hug my daughter a little longer at night every time I hear a story about Mr. Floyd, and I think about my brothers and men in my family. Another Black American that is killed in this way. And it's a generational burden. I know my own mother carried it, and I carry it too. Our communities face some of the most dangerous circumstances we have perhaps ever faced. We need our police to be working alongside of us, supporting us, and protecting all of us. They are responding to thousands of calls for service every day in every neighborhood and doing heroic work daily under the most difficult circumstances perhaps ever. They are adjusting to this outbreak while still called to deal with the challenges they face long before this pandemic came into focus. Challenges like tackling open-air drug markets that have only gotten more difficult and more dangerous in the last few months, or curbing gun violence, which is always tough, and particularly in the summer months, and it's even more demanding when we can't deploy the full protective network of social support that we know is a critical component of violence prevention. Even in these circumstances, Superintendent Brown and I are in lockstep. We are united in our vision for public safety, our shared vision for how to strengthen and deepen the most important thing that the department can do, which is to build authentic, trusted partnerships with the community. And we are united in making clear to our officers that we hold them and that they must hold themselves to the highest standards. We simply can't go backward. There are some communities, particularly in the South and the West Sides, where Chicagoans call for police presence more often. That is their right, and they are entitled to service. They must be able to do so with the expectation that when they call and the police arrive, they will be treated with the same respect and dignity on the South or the West Side that they would in my neighborhood, in Logan Square, or in Roscoe Village, or in Lincoln Park, or Portage Park. Let me also take this moment to clarify some of my comments from Tuesday. I have said that the violent weekend was a fail, and it was. The number of shootings was simply unacceptable. But some interpret my comments as targeting Superintendent Brown specifically, and let me be very clear, nothing could be further from the truth. Superintendent Brown has and will continue to have my unflagging support, full stop. I am 100% plus committed to his success, and I have, what I have seen so far, I have every confidence that he will be one of the greatest leaders that the Chicago Police Department has ever been graced to have. Now, Getting through this most challenging time is going to continue to require all of us to be steadfast and vigilant in every neighborhood. But we must also remain steadfast and vigilant in our commitment to fairness, to equity, and to justice. That's how we can make sure every one of us can feel safe. And I dedicate myself to that principle every single day, and today is no different, nor will tomorrow be. Now, let's turn to the purpose of our gathering here today. I want to acknowledge the people who are standing here with me. Our Deputy Mayor for Economic and Neighborhood Development, Samir Carr, who has done tremendous, tremendous work throughout this pandemic and is the reason why we have been successful on many fronts. I want to recognize Gary Cooper, actual name, Gary Cooper, who is the CEO of Reaply. And who was responsible for helping us set up our PPE marketplace. And a woman you all know, our Public Health Commissioner, Dr. Arwady. For the past 2 months, our city has undergone an unprecedented effort in response to an unprecedented crisis, turning our lives and our entire economic life upside down in order to keep our city safe from the COVID-19 virus, and to keep our healthcare system from being overwhelmed. Throughout this time, I have been deeply gratified by the service and sacrifice made by countless Chicagoans from every corner of our city and every walk of life. That starts with the incredible work undertaken by our healthcare professionals, first responders, and essential workers who make sure our residents are cared for and keep our entire city running. But our ability to meet this moment would not have been possible without the work and compassion of countless other Chicagoans, people like you, who have stepped up in this time of need in our city in tremendous ways. From the small army of individuals working in our food distribution centers, to our teachers and school staff who have allowed our students to learn online, to every Chicagoan who did their part by simply staying home and saving lives. It's because of your efforts that I am very happy to announce that on Wednesday, June 3rd, the City of Chicago will be taking our first step into phase 3 of our reopening process by allowing many of our businesses and city areas to partially reopen to the public. As we announced last week, these businesses will include our office-based jobs, professional services, and real estate services with capacity limitations, along with hotel, lodging, and limited outdoor attractions, including non-lakefront golf courses. We'll also see the partial reopening of restaurants and coffee shops with a focus on outdoor space, as well as non-essential retail stores and personal services, such as hair and nail salons and barbershops, with precautions in place to protect workers and customers. We will also be reopening childcare and in-home family daycare facilities, all of which support our work that needs to be away from home. Our phase 3 reopening for city services will be delayed by a few days, but it too will reopen on June 8th. So for all you parents listening, that means our kids can start using libraries and park facilities west of Lakeshore Drive. These new steps are accompanied by guidelines for specific industries, all of which are now available online at chicago.gov/reopening. I want to take this moment to note that Chicago was the only major city in America who did not cut service to transit systems during this crisis. And Dorval Carter, the president of the CTA, and all the hard-working men and women who made this possible at the CTA deserve our thanks and credit. However, we will still need our travelers to maintain social distancing as we move to phase 3 in our reopening on Chicago Transit. For that to happen, We'll need our businesses to stagger start and end times as much as possible so as not to overwhelm our CTA during traditional peak hours. I also want to remind all of our local small businesses, community-based organizations, and small not-for-profits about our partnership with local startup Reaply to provide them with access to purchasing face coverings, hand sanitizer, and protective barriers from local Chicago vendors so that they can be prepared as we cautiously reopen. We also announced last week our hope is that during phase 3, we will be able to begin reopening other parts of our city, including summer programs, youth activities, religious services, gyms, and yes, our lakefront and beaches. But we'll have to wait to see how these initial first steps go. Which brings me to something that I want to remind everyone about. Let's be clear. Under no circumstances should our move to phase 3 be confused with this crisis being over, because it's not. COVID-19 is still very much part of our present. I can't emphasize this enough. And as we reopen, please understand that we're doing so with the full knowledge that we cannot totally eliminate risk of this virus. The best we can do, and really the best that you can do, is continue following the public health guidance around social distancing, hand sanitizing, and please, wearing a mask in public. Having resurgence in cases is more than just a risk. It's a very real possibility. And we have seen this in other nearby states. All we have to do is look to the north, the south, the east, or the west for examples. And if this happens, we will not hesitate to take the necessary steps, including moving back into phase 2 if necessary. So folks, let's just be smart. Let's follow the guidance. Let's follow the social distancing, wearing a face covering in public, doing all the things that you have done because you know that this saves lives and reduces the spread of the virus. It's for these reasons that phase 3 will only allow for small, non-business social gatherings of 10 people or fewer. And we will still have us wearing face covering and physically distancing when meeting others. It will also have us saying and really pleading that if you are sick, you must stay home. And anyone who's come into contact with someone from COVID-19 must take the necessary precautions, including isolating yourself. And those who have COVID-19-like symptoms must immediately reach out to a healthcare provider. In conjunction with our phase 3 reopening, we are also launching our new public awareness campaign called Be Safe Chicago, across our social media, billboards, radio, and other venues. To get the word out about phase 3, what phase 3 entails, and to help ensure there's no confusion about what it means for our city and our residents, we will be embarking on this public campaign. During our first 2 phases of COVID-19 crisis, our campaign was Stay Home, Save Lives, and it worked, helping us get to where we are today, and we are grateful for everything that you did to make this possible. Now, our job, as we start to cautiously reopen, is to be safe. We may be moving out of our homes, but this phase is still fraught with risk. And the only way for us to be successful is for all of us, you and me, to focus on being safe together. It's in that same spirit that we're also embarking on a new partnership that I'm excited about with the Second City, Chicago's legendary comedy institution, to produce a weekly web series entitled Phased and Confused that will communicate information about our Protecting Chicago 5-phase reopening framework. And lastly, I also want to take this opportunity to ask our residents to take a new survey, a recovery survey, which is available on our city's COVID-19 website Chicago.gov recovery survey. Hearing from all of you is enormously helpful as we develop our phase 3 plans, and we don't want that to stop. So please keep it coming. Fill out our survey and give us your thoughts about what recovery should mean for the city. And help our task force, which is now looking forward to life in phase 3 and beyond. Folks, this is an exciting moment for our city. The world will be watching how we do. And I want to make sure that when those reports start coming out, that Chicago is a model for the nation and the world, that we came out of stay at home in a smart, sensible manner because our residents understood each of our obligations to be safe and the things that we needed to do to get there. I want to express my gratitude once again to everyone who has made this moment possible. Everything we have done to meet this moment has been the direct result of your hard work and sacrifice, following the public health guidance, even at great sacrifice to yourself, and being uncomfortable at moments, which has not only saved the lives of thousands of Chicagoans over these past 2 months, but it's helped lay the groundwork for the transformative recovery that we're all excited to embrace. Thank you for everything. And at this moment, I want to invite Dr. Arwady to give us further details on our city's health metrics at this time. Doctor?
Thank you, Mayor. So I'll note that just in the last 24 hours, the U.S. passed 100,000 deaths from COVID-19. Illinois passed 5,000 deaths from COVID-19. And here in Chicago, we passed 2,000 deaths from COVID-19. So as we are thinking ahead and moving cautiously into phase 3, I want to remind people that these are each individual people, and that the work that we've been doing has helped to save lives, but that we are not done, unfortunately, seeing cases and seeing death, including here in Chicago. And so I'm excited to share the progress that we've made and that we are almost there in terms of being able to start looking ahead. But I'm going to just start from the beginning with echoing what the mayor ended on, that much more important than a specific date or a specific time frame or a specific piece of decision that an industry needs to make about how to keep its business as safe as possible. The most important thing as we look ahead through the summer and all the way to a vaccine is how well people in Chicago continue the physical distancing, keeping that 6-foot distance whenever you can, wearing the cloth face coverings that are about protecting your neighbor as much as they're about protecting yourself, staying home if you are sick, even a little bit sick, or you've been exposed to someone with COVID, and continuing the hand hygiene. Moving ahead does not mean these things go away. And every model that we look at, including the one with Argonne National Labs, which is the one really based on Chicago's population, making sure that the majority of our residents continue to do those things is the difference between continuing to see a decrease over the next few months or potentially getting to a place where we have an outbreak that gets out of control again quickly and we have to take steps backwards. So I'll just go over quickly where we are on the metrics. All of the details are on chicago.gov/coronavirus, and I will be going over tomorrow during the Facebook Live at 11 a.m. actually with the Chicago Department of Public Health epidemiologists whose teams really put a lot of this together if you've got questions. When we spoke last week, I noted that we were in a good place from hospital capacity, and we're still at a good place. That we were in a good place from testing capacity, although we have some concerns about percent positivity. That we were in a good place, although still making progress in terms of our response capacity, and the RFP that we released earlier this week that will build our ability to have contact tracing as part of the plans there. And that we were just cautiously starting to see see that first week of real decline. And I'm happy to say that we are making progress still in every one of these areas. So first and foremost, this chart shows that our new daily COVID-19 cases are still high, but they are continuing to decrease. So it's flattened a little bit, but we continue on the way down. Here, we see that new cases continue to decrease across all race ethnicity groups. You'll note in purple, the Black non-Latinx cases really peaked in April and have continued a downtrend, although we're seeing that stabilize. We're still seeing well over 100 new cases every day among African Americans in Chicago. Latinx in particular has peaked later. That did not peak until early May, but we are now seeing some real decline there, but we're seeing well over 250 cases every day among Latinx Chicagoans. Similarly, seeing declines but stabilization among Asian and white Chicagoans. So good progress there. Hospital admissions also continue to decrease. We're almost to our 14 days here in terms of being able to really count on this being an ongoing trend, but as we've been counting forward, this is looking good, and it's the part that I feel in a lot of ways the most confident about. It's where we've had consistent testing for anybody who's been sick enough to need to go into the hospital. Our capacity is strong here, and it's part of why, even while we have a lot of COVID-19 still here in Chicago, we're feeling good about moving into a cautiously reopening phase. Our ICU occupancy, you can see here, is stable, just starting to decrease. We still have more than 400 people in Chicago in the ICU with COVID, and we will want to see that continue to come down, but we're making careful progress there as well. And then next, here's our deaths. So we're at about 10 days now where we've had stable or decreasing deaths. Obviously, this also can lag a little bit in time, but we're feeling good about where that is, even while we recognize that our more than 2,000 deaths are really more than 2,000 than we would have wanted to see from the beginning, and feeling strongly that all of us protecting each other is how we'll see this really ultimate metric move down the most. Our testing capacity in particular, I'm really proud of the progress here. So you'll remember when I was up here just a week ago, we said we're almost to our goal of testing 4,500 or more per day, which represents being able to test 5% of Chicagoans every month. We've now exceeded that, and we're up to 5,303 tests per day as a 7-day rolling average. That is not antibody tests. That is diagnostic tests, one test per Chicagoan, and that's been, you've heard us talking about additional testing sites that Chicago has stood up. We're going to keep working on this. We're still not done building testing capacity, but I'm very pleased with that progress. Then we get to our congregate setting work. This, again, I'll remind you, is our percent positivity, the percentage of tests that are positive out of all of the tests that are done in our highest risk settings, our long-term care facilities, like our nursing homes, our homeless shelters, our correctional facilities. And here, we've actually exceeded the goal that we set. We said we want to see a 30% positivity goal in these settings because they're such high risk. If you look back, as recently as early April, we were at an 80% positivity in these settings. But we've had very aggressive work here, and the fact that we're down to a 15.2% positivity is a sign that in a lot of these highest risk settings, we've really turned the corner, and I feel very good about this. So this brings us to really our last metric, and this is the percent positivity in our community settings. Here is where we set a 15% goal, and we're close. We're at 16.3% now positivity in our community settings, and you can see that that too has been decreasing. But let's move and look at what that means in a little more detail. So this is data not cumulatively, but just from last week. The tests that were done between May 17 and May 23 here in Chicago, 27,234 tests. When we look at this map, we can see that a lot of the city still is well above that 15% positivity mark. And just because the numbers are small, let me just translate the what this is in detail. So those darkest zip codes, primarily on the west and south sides, have between a 22.3 and a 31.5% positivity. As much as almost 1 in 3 people being tested for COVID still being positive. The next darker blue, which you can see extends up into the north side and a little bit further east, that's our 16 to 22% positivity. And more than 1 in 5 Chicago zip codes still had greater than a 20% positivity last week. Now, is there a big difference? Should we be so concerned about 16%, 15%, 20%? This sounds like progress, and it is progress. But let me just put this in some perspective of where the rest of the country is. Cities have been hit particularly hard by COVID-19. And we set that 15% goal, recognizing that it was going to be a lot to get us from where we were at 30% previously. But our sister cities, including ones that had bigger outbreaks than we did to start with, are a lot farther along than we are. Los Angeles is at an 8% positivity. Seattle, where this all started, is at a 4% positivity. New York City is at a 6% positivity. And where we look even closer to home, Michigan is at a 6% positivity. The other states are really broadly looking at 10% and definitely less than 15% positivity. And so where we thought about, are we ready to go tomorrow versus are we going to wait a few more days to get to the point where we can hit that 15% target? We felt that probably by Wednesday, we will be there. We know that people need to make plans, and so setting a date of June 3rd is an estimate of how long it will take. But that community positivity is the one that makes the difference for the people in the community who are coming into the businesses, who are starting to come back to restaurants, who are out and about, and where we actually see that spread. It is easier in a lot of ways to control spread in our high-risk settings, in the congregate settings, than it is in the community. And particularly where you look at how this disease has disproportionately impacted communities of color here in Chicago. And I look at this map and know that we are all one city, and there are large parts of the city that still are at an unacceptably high level. I'm confident that by next week, we will be there. A few days may seem, does it make a difference, does it not? A few days made a lot of difference on the front end here, I think, where we thought about really moving very quickly as a city and as a state to get a lot of those limitations in place. We moved a little faster than New York and some other places did. And I want to feel confident that as we're moving out on the other end, we're sticking to this metric and really looking to be in a place where we will cautiously be able to move forward. So I'm as excited as everybody else is to be able to start making those changes. But we have a lot of COVID still here. We will need people to continue to be cautious, continue to follow the guidance, and continue to be safe. And with that, I'll bring up Samir Carr, the Deputy Mayor of Neighborhood and Economic Development.
Thank you, Dr. Arwady, for that introduction. As you all just heard, my name is Samir Carr, and I'm proud to serve as Deputy Mayor for Economic and Neighborhood Development. Now, as a former small business owner, I have experienced firsthand what it's like to operate a business through the trials and uncertainty of a crisis. Chicago's business community represents the bedrock of our city, and our economic diversity and capacity for innovation in particular stand among our greatest strengths. Without business, we cannot grow, much less experience the inclusive growth of the neighborhoods we need to thrive. But our businesses, small and large, have suffered tremendously during this crisis. To give you a sense of what they've been facing, before the COVID-19 crisis reached our city, the average small business in Chicago had just 16 days of cash on hand, and that was over 2 months ago. This impact has also quite literally hit home for our employees as well, with our hourly employees seeing their hours drop on average by 70%. To support our businesses during this critical time, we moved aggressively to develop our $100 million emergency loan fund, as well as creating a $5 million grant program to support over 1,000 micro businesses in targeted communities, both of which complemented state and federal funding programs. But our work continues. As Mayor Lightfoot just announced, on June 3rd, it's time for Chicago to cautiously reopen. Our plan for reopening is informed by the science and is focused on getting Chicagoans safely back to work. This will entail over 130,000 Chicago workers going back to their jobs. As the mayor noted earlier, we released an array of industry-specific protocols in preparation for this move, which were created in close collaboration with over 200 working group members, ranging from industry, organized labor, and community-based organizations, and all of which are rooted in the data and science of this disease and designed to strike the right balance between our public health and our economic health. And as Mayor Lightfoot has also noted, reopening the economy gradually, like a dimmer knob rather than a light switch, puts us in the best position to strengthen both. We also want our consumers and workers to know they're in safe hands when they're at work or when they're shopping in our stores. Nonetheless, despite the excitement of today's announcement, we know that many businesses will not be coming back online next week, or perhaps not during Phase 3. We all want you to know that we're doing everything we can to be creative, to be adaptive, and to be supportive with our policies to give you the support you need while protecting the health and safety of our residents. As I mentioned earlier, one of our city's greatest strengths is the enormous capacity of our business community to innovate and transform in the face of tough circumstances. And I'd like to share a few of those stories with you right now. One is about Novias Davila, a wedding and quinceañera dress shop that has been part of the fabric of Little Village for nearly a decade. During this crisis, they pivoted their business model to making and distributing thousands of masks to community members. Charmaine Riquette of Uncle Remus Sauce Fried Chicken, with locations in Austin and in Brownsville, met the challenge of COVID head-on by building up her company's online presence to continue allowing it to serve food, generating revenue, and keeping her employees working. Over on the north side, Koval Distillery stepped up by donating over 3,000 gallons of hand sanitizer for frontline health workers and first responders. They've also started a new line of business in selling hand sanitizers to Chicago's business community. And right here in downtown, reservation service Talk has historically allowed patrons to reserve tickets and tables at fine dining restaurants. In response to COVID, Talk built a delivery and pickup product in 6 days, and over 1,500 area restaurants, most of them new customers, are now using the added platform feature. As a result of this new feature's demand, Talk increased their customers by nearly 500% and will be keeping this functionality going forward. True models of innovation despite this crisis. As we move into the next phase, we will continue working together and to be creative where needed to get the rest of Chicago's businesses safely online. We want our dialogue to be about how we can use this opportunity to help you and our entire city come back from this crisis stronger, more resilient, and more successful than you've ever been. And that leads me to our next speaker today, the founder and CEO of Reaply, Gary Cooper. Our team in City Hall first learned about Gary when we were looking for a homegrown solution to help our businesses and community organization gain access to affordable protective equipment that would allow them to safely reopen. Gary and his company Reaply were more than up to the challenge, and I'd like to invite him up to the podium to tell us a little bit more about the platform and what they've been doing.
Thank you, Samir and Mayor Lightfoot. Hello, I'm Gary Cooper, and I'm the CEO and co-founder of Reaply, a resource-sharing startup in Chicago. Reaply recently partnered with the city and World Business Chicago to launch the Chicago PPE Market, a platform that is facilitating access to PPE for Chicago small businesses and nonprofits. As the city prepares to enter the next phase of reopening, many organizations are faced with the challenge of affordably and easily acquiring supplies to help and protect their workers from contracting or spreading COVID-19. To support safe and efficient reopening, I am pleased to report that Ripley's technology is enabling access to locally sourced PP supplies, and including protective shields, reusable face masks, and hand sanitizer at cost-controlled rates. Without a doubt, this is a very important time to support our small business community, as they are the very backbone of our economy. The Chicago PPE market does just that. Once more, with the Chicago PPE market, small businesses and nonprofits can easily and affordably access the equipment and supplies necessary to keep staff and customers safe. In the first 36 hours of the Chicago PPE market's launch, there have been over 900 small business owners to fully onboard and create accounts, with 69 of those small businesses procuring 27 protective barriers, 368 bottles of hand sanitizer, and over 1,500 reusable face masks. And that was just in the first 36 hours. We, Ripley, look forward to continuing this important work with the city and the Chicago business community to help get the city of Big Shoulders back to work safely and smoothly. Please be well and be kind. Thank you.
Happy to take your questions.
Mayor, thank you. There are several about restaurants reopening, one from Sarah Schulte from ABC7. How, and I think Gary did mention this, but how is the city helping those, especially on the south and west sides, that do not have outdoor seating and may not feel perhaps it's safe to add the outdoor seating? How is the city helping them?
Well, we are deeply and have been involved with neighborhood chambers of commerce, restaurateurs themselves, all over the city, and particularly in neighborhoods. You know, look, I want to make sure that we are aligned with the governor's vision. But I have talked to him specifically about the challenges that many of our neighborhood restaurants face. The reality is that they may not have the resources or the personnel to be able to have their dining be completely outside, completely al fresco. They need to have that indoor dining component, and I know that he is contemplating how to do that and how to do it safely.
Fran Spielman from the Sun-Times is asking about the capacity limits you have established for offices. Do you expect rush hour to be spread out across the day with this staggered shift? If so, how will the CTA accommodate that?
Well, what I've been hearing from both workers and also from employers is that in many instances, they're not coming back downtown, and certainly not full-time, until much later in the summer, or in some instances, even the fall. So I don't think we're going to see, for example, February levels of rush hour. But that's why I'm calling upon employers, if your people can telework, that's the safer option. Or if they're coming back downtown for reasons that make sense from a business standpoint, think about staggering the starts and stop times so that we can spread out the amount of people that are going to be on really the CTA, but also Metro at any given time. The CTA has, I think, released yesterday or releasing later this week, very specific guidelines, how they're going to step up and do enhanced cleaning, what they're going to be doing in terms of adding more buses and cars so that people can safely social distance. There are going to be markings at bus stops and on platforms. So I think they've got a very well thought out plan, but we don't know what those plans are going to be sufficient until we really kind of see what the cadence of people coming back downtown to work is like.
And back to that outdoor dining, are new permits needed for those who don't have outdoor permits now?
So what we are hoping will happen is there is a permit that's available. We're encouraging folks to work through neighborhood restaurant associations. That's the easiest way to do it. Or if there are 3 restaurants on a street together, they can certainly apply. There's a fast track permit that we're allowing through the Department of Special Events. But we've been working with the Illinois Restaurant Association and a lot of other entrepreneurs to get that information out. But we want to be bringing these restaurants back online as quickly as possible.
Fran is also asking, have you spoken to the governor, because you had talked about the fickle weather of Chicago, about perhaps allowing for some indoor dining?
Yeah, I just mentioned that. I have spoken to him very recently about this very issue and really made the case for neighborhood restaurants. I mean, some of the bigger folks, obviously every single restaurant in the city has been tremendously impacted by the closure in response to our efforts to contain COVID-19. But what I really worried about is those small neighborhood restaurants that the cash flow is very limited, and really thinking about, can they prepare to open back up if they don't have the reliability of income from in restaurant dining. I talked at length with the governor about that, and I know that he understands the importance of making sure that we can give those neighborhood restaurants in particular that opportunity.
Not to belabor restaurants, but there are a lot of questions.
I know, there's a lot of restaurants.
Will bars have to wait until, this is from Kelly Bauer of Block Club, will bars have to wait until the June City Council meeting for cocktails to go, or will your administration speed it along? Will there be any other forms of relief for bar owners coming in phase 3?
No, we're going to wait to City Council. This is really something that the City Council needs to take on, but we feel confident that we'll be able to now adapt quickly. We've got an ordinance that we're drafting. We're talking to members of City Council about that, so that this opportunity that's now been provided by state law will become a reality.
There have been some streets that, what's the proper word, have they closed or opened? I mean, they're opening for more folks to be able to walk and bike. Will Jones from ABC7 is asking, how are you going about deciding which streets and communities will take part in the Shared Streets initiative?
Well, we're doing it, obviously, looking at traffic patterns and how we can easily reserve those walking spaces and do it safely. We're, of course, doing it in conjunction with local stakeholders and, importantly, local aldermen. So that's really kind of the process that our Department of Transportation has been engaged in now for some time, looking at opportunities for safe streets.
There are questions about street cleaning because it has begun again, and yet with so many now working from home, the question is, where are those cars supposed to go?
Well, look, this is a challenge no matter what, because a lot of people don't have off-street parking, but we are doing what we normally do, which is giving people several days' notice that the street sweeping is coming, and it is inconvenient always, but I think that they can be accommodated on local streets nearby, wherever the street cleaning itself is happening.
Vince Girasoli from CBS2, there has been, he asked about the streets, but let's move to the other one. Have you made the decision about Lollapalooza?
We'll be making an announcement about that relatively soon. We're going to be doing that in conjunction with other things that are going to be happening over the course of the summer, and our plans to bring music back to Chicago.
And he also is asking, some merchants on those closed streets are concerned this will block off easy access to their business. I guess you can't make everybody happy, can you?
Well, you can't make everybody happy. I know that very well. But that's why these conversations have to happen in collaboration before any definitive decision is made. So we've heard from some folks who say, I don't want this on my street, and we've heard from others, how can we get in on this? So we're taking them block by block. We're not doing a one-size-fits-all approach, but it's really about communication and collaboration.
From Becky Vivi from WBEZ, registration for Park District programs opens on Monday. Could you talk about your decision to have Park District programs resume on July 6th? And will the city follow the state's detailed guidelines about summer camp programs, or will you have different rules for the city of Chicago?
The Park District has been in lengthy conversations with folks at the state level. We will be putting out very specific guidelines so that parents can have a window into that before they make decisions about what their summer options are going to be for their young people. Probably a month plus ago, all of the summer programming providers, parks, libraries, and others asked for summer programming to start right after 4th of July so that they'd have more than adequate time to prepare. But I think we'll have a very good set of robust offerings for the summer, and we know that that's important, particularly for working families.
And is there any more news on professional sports? Do you believe, in respect to baseball or other sports, do you believe, according WGN Radio is especially asking this, will they be playing the games to empty stadiums, or what might happen in Phase 3?
Well, all of these decisions are still in discussion at the league level. My expectation is that in the first instance, yes, they will be playing to empty stadiums. I'm really enthusiastic about the possibility of getting hockey playoffs here in Chicago. As you know, we are a hockey city. We're one of the original franchises in the league. Hockey is deeply ingrained into the sports fabric of our city, and I'm going to do everything I can to support the efforts of the Blackhawks and others to bring hockey playoff to Chicago.
Now, late June for the Lakefront. Does late June mean?
I didn't say late June. I said later in Phase 3.
And later in Phase 3, do you envision a couple? What's the goal, perhaps?
Well, the goal and why we're taking our time with this is the lakefront is a beautiful, incredible treasure. And I want to make sure that when we open it back up, we do it in a way that people can enjoy it safely and smartly. And what I don't want to see happen is scenes that we've seen, for example, from other states, where you open up a resource that people really love and enjoy, and then it gets mobbed, and you see people abandoning all of the hard work and social distancing and public health guidance that really got us to the point where we can even talk about opening. So we are being really thoughtful and methodical. We're talking to a lot of different stakeholders. Of course, the aldermen that touch the lakefront, the Park District obviously will take the lead on this, but we want a plan that where we don't have to say, okay, this is terrible, we got to shut it back down. We want to be smart and thoughtful and intentional about how we reopen our lakefront and beaches. We're looking at examples from around the country. We've spent a lot of time, for example, looking at Los Angeles County and what they've done with their beaches. For us, it's not just the beach, it's not just the lakefront path, it's not just the parks that are adjacent to it and the golf courses. So there's a lot that goes into our consideration of how we open this back up, and boating is another part of it. So we will, I think we'll be in a position to announce plans soon, but I don't want to put a specific date on when that's going to happen. But we are actively involved in looking at ways in which we can bring this important resource back online and do it quickly.
One more question from WBEZ. There's a huge gap in information about the types of workers getting sick with the coronavirus throughout Illinois. As public officials try to contain the spread of the virus, Mayor, you've required hospitals to provide more demographic data.
Yes.
To better understand it, and especially how it's impacted people of color. Yes. What about requiring them to provide information about the types of jobs patients have so you can get ahead of future outbreaks?
Well, I think we have some knowledge of that, and I'll defer to Dr. Arwady to give specifics.
Yeah, it's a good question, and it's certainly an area that is of concern and interest to us. Where we get a full case report form submitted, there obviously is a space for entering the occupation, but through all of this, we've seen a lot of this lab data just coming through what's called electronic lab reporting, and that sort of detailed information often is not accompanied. So what we're actually doing first and foremost on this has been some of the behind-the-scenes technology work that we are doing, just new things that we've never done before. Actually, it's never really been done anywhere in the country some of the work to pull together electronic health records from all of the hospitals and then eventually all of the outpatient centers into a single sort of CDPH database that is only reporting in on COVID patients, but allows us to mine all of that information for things like occupation without needing to necessarily slow down things like filling out the information to get the testing done. So we're working kind of on the back end to have some of that filled in. But also we are thinking about ways as we build up more testing capability to have some of that data captured electronically right from the beginning. As part of the reopening guidelines, you'll see in there that there is some information about what businesses or other gathering places should do themselves if they have cases. We have orders forever. Healthcare providers have been required to report, but we recognize that there may be situations where an employer may actually note first that there could be a connection here. And there will be ways, and we've made it very easy for people to be able to let the health department know if they're seeing a connection on that side. And then the last thing I'll say is that as we'll be doing some survivor follow-up, we're very interested in following people who have recovered from COVID. Are there ongoing issues with physical health or mental health or social needs? We'll use that opportunity to also go back and fill in some of that missing occupational or even demographic data, because, you know, I hope we never get to a point where we're seeing a second wave, but I want to have a really good sense of very specific risk in Chicago, and that's one of them. So we're taking a multi-tiered approach to thinking about that, but it certainly is something of concern.
And a follow-up to that. Oh, dear. Okay, let me move on then to Minneapolis, because there are many, many questions about that as well. And I regret that I don't have all the names, but there are several folks who are asking, and of course you addressed it. But the question as well is, what about Chicago? Yeah. Are you concerned? How is Chicago prepared? There have been a couple of incidents apparently overnight. Are the Chicago police on guard for perhaps any incident here as well?
Well, look,
or reaction?
I mean, the reason I said that there for the grace of God go Chicago is for the very reason. There's no mayor in any big city that has the diversity that we have here in Chicago who can't be thinking every single day, watching what's happening in Minneapolis. This could be me. This could be our city. This could be us going through this incredibly challenging time. And you know, I had a very good conversation earlier today with the superintendent, and he believes, and I think he's 100% right, that the time to prepare is now, before the crisis hits. The hard but important and essential work every single day of building legitimacy, authentic relationships with members of the community. So even when you have a difficult circumstance, that you have a well of goodwill that you can draw upon in trying to diffuse it. So there'll be things more visible that both he and I will do to really speak to this moment. That's why I felt compelled at the beginning of this press conference to really address it. But I have to tell you, and I know the mayor of Minneapolis, and I think he's doing a very good job under extraordinarily difficult circumstances. To watch the entirety of that video and to see the life leave another human being on the ground, literally begging for his life, saying he can't breathe, getting no relief, and just then seeing when the paramedics came, how callously they treated him, almost like he was a piece of meat. It sickened me. And I want to make sure that something like that doesn't happen in our city. And the police, and I believe this, they have a really difficult job every day. Made all the more difficult in the time of COVID. Made all the more difficult in certain areas of the city, for example, where there are open drug markets, open air drug markets, and addicts that are literally wandering the street in a half nod, having gotten a fix or looking for their next fix. I've driven those streets and I've seen those poor souls in those neighborhoods. That's hard to police under those circumstances, and then layering onto it the COVID and the fear that every man and woman in the police department has to have about, am I going to be the next person? Am I going to get sick? Am I going to take that back to my home or a loved one? Really difficult time to be focused on public safety, but we must. We must, because everyone in every neighborhood has the same right to expect to be able to walk out their door in freedom and liberty without the fear of being felled by gun violence. And unfortunately, that's not a reality yet in too many areas of our city. So it's this perfect storm. And I worry about it, of course. But we have to do the hard work every single day, not just when there's a crisis.
Should that officer face murder charges?
You know, look, I don't know enough about the individual circumstances for me to be able to make that assessment. What I can tell you, as somebody who's investigated police misconduct and as a former prosecutor, that I surely hope that the authorities, the prosecuting attorney, the U.S. Attorney's Office in Minneapolis is looking hard at this case. We just can't live in a world where somebody gets arrested over something petty and loses their life. And the man was not resisting for a long time over the course of that video. He was saying that his air was constricted and that he was having a difficult time to breathe, a difficult time breathing. And then one of the things that was so powerful to me is watching the life go out of him. And then when they rolled him over in handcuffs, seeing the spot where his face had lain on the ground, just wet with his perspiration, I think, as he was dying.
Last question,
Mayor, the last question is about the Chicago Public Schools from Fran. Fewer than 60% of all CPS students are engaging with online remote learning 3 or more days a week. The vulnerable population, Black and Hispanic students, those who are homeless, are lagging even at a lower rate. Thousands have not been reached. How do you reverse this trend at a time when at least a hybrid, some kind of remote learning is very likely in the fall?
Well, look, I think this is a very tough circumstance. I commend CPS for putting this data out. What I know is I think the most important thing that we have to do to resolve this issue is bring broadband equity to every neighborhood in our city. And we are working on and will be announcing relatively soon a plan that focuses on bringing that kind of equity to CPS students. But we knew that the digital divide was real. We knew that there were too many stretches of our city that simply didn't have access to Wi-Fi or the internet. CPS has pushed out literally hundreds of thousands, tens of thousands of devices. But if you don't have connectivity, you're going to see the kind of numbers that you see here. And we've got to solve that problem as a city, because we cannot afford our children to be deprived of the ability to be educated and to learn.
Thank you, Mayor. Thank you, Mary.
Thank you.